Welcome to the Queen of Hearts podcast. And here's the queen herself, registered dietitian Heather Klug.
Hello, everyone, and welcome to the Queen of Hearts podcast. With me today is Bethany DeBrew Adams, my co-host. Welcome, Bethany.
Hi, Heather, again remotely.
Yes, Bethany is still recovering from coronavirus, but she has agreed to be with me on this podcast today, so I'm thankful for that. I think most people know that October is Breast Cancer Awareness Month. The pink ribbons and pink products are everywhere, right, Bethany?
Definitely.
Something that many people might not be aware of, though, is that breast cancer and heart disease actually intersect in many ways. So much so that the American Heart Association issued a scientific statement in 2018 discussing this emerging issue. In part one of the connection between breast cancer and your heart, we're going to discuss the overlapping risk factors between heart disease and breast cancer with a brief overview of how breast cancer treatment affects the heart. In part two, I'll be interviewing a doctor and a nurse practitioner from the Karen Yontz Center for Cardio-Oncology at Advocate Aurora Health about the adverse effects of cancer treatment on the heart and learn how the Cardio-Oncology Center is helping patients minimize damage to the heart.
Very interesting topic.
Yes.
So breast cancer and heart disease are both big health threats for women, causing both morbidity, which is to say poor health, and mortality, which is to say death. So what's interesting is that if I were to go out and survey just a bunch of different women about what their biggest health threat is, they're most likely to say breast cancer. But if you actually look at the data, the number one health threat for women is heart disease, or more specifically, cardiovascular disease. And that means it includes not only your heart, but also your entire vascular system, your veins, your arteries, and anywhere they might lead, like your brain as well. So not that breast cancer isn't a big deal, because obviously it certainly is. It just seems like anytime we hear the word cancer, we panic. It's that the big C, but you're going to tell us right now, the statistics don't lie, and they point to heart disease being the bigger risk.
That is very true, Bethany. Heart disease is far more deadly for women than breast cancer. It kills more women than all forms of cancer combined. So let that sink in. 1 in 3 women die from heart disease in the United States versus 1 in 31 for breast cancer. So 10 times more women die from heart disease, basically.
Wow.
Yep. Now, there's been a decline in deaths for both cardiovascular disease and breast cancer, so that's good news.
Yeah.
But still, far more women die from cardiovascular disease. When we look at other statistics, more women are surviving breast cancer. There's a 90% survival rate past 5 years.
Which is awesome.
Yes, that's awesome. However, the same cannot be said for heart disease.
Which is not awesome.
That's not awesome. According to the American Heart Association, 26% of women will die within 1 year of a heart attack. By 5 years after a heart attack, 50% of women will either die, develop heart failure, or have a stroke.
Wow, that's a lot. So let's dive right in and talk about the overlapping risk factors that breast cancer and heart disease share. So researchers have found that breast cancer and heart disease share a lot of these risk factors, a lot of which you've heard us talk about on previous podcasts. If we know what to work on, the good news is we can reduce our risk for both heart disease and breast cancer, which is awesome. So let's start, Heather, first with age.
Yes. So both breast cancer and heart disease rates increase with age. With breast cancer, the risk doubles every 10 years up until menopause is reached, and then the rate of increase slows down. With cardiovascular disease, the rate of increase becomes much steeper at menopause because women are protected up until then because of estrogen, but then the rates continue to increase, okay? I thought that was interesting. I thought the rates went up after menopause, like heart disease did, but it's actually,
The
before
opposite.
menopause is reached.
Yeah.
Yeah, which is interesting. Researchers are also looking at the age of menarche, which is when a girl first gets her period, right? And
Mm-hmm.
then menopause, and they find that they're both age-related risk factors for both heart disease and breast cancer. So if a girl gets her period really young, under 11 years of age, that girl as a woman is at an increased risk for both heart disease and breast cancer.
Okay.
Now, menopause is different. Early menopause, that's defined as less than 45 years of age, is associated with an increased risk for heart disease, but a decreased risk for breast cancer. So it
Hmm.
helps in one, but not the other.
Yeah,
Yeah.
that's
Yeah.
interesting.
Well, it all goes back to those hormones, Bethany.
Yeah, definitely. And speaking of hormones, we know that hormone replacement therapy is used many times with women after menopause or sometimes during menopause as a treatment. So does that impact breast cancer and heart disease as well?
Yes. In fact, use of hormone replacement therapy, or you might hear it as menopausal hormone therapy, increases the risk for both breast cancer and heart disease, unfortunately. The Nurses' Health Study found that the risk of developing breast cancer was 1.2 to 2 times greater for women using being on hormone replacement therapy for 5 years or longer compared to women that never used hormone replacement therapy.
Wow.
Yep. And then the Women's Health Initiative also found that heart disease risk also increased in postmenopausal women who used hormone replacement therapy. It was mostly that combined therapy, which had both estrogen and progestin in it.
Okay.
This study actually had to be terminated because the risk of heart disease was so high. So,
Wow.
the thinking has kind of changed with hormone replacement therapy now, in that women can still use it, but your doctor will look at a lot of different criteria and kind of determine your risk. A lot of it is based on that 10-year risk for developing heart disease. And in fact, they won't even often give it to women over the age of 60 because the risk for having a heart attack or a stroke is too high.
Okay. Well, let's talk a little bit about exercise and physical activity because this is something, we know impacts your heart health definitely, but how does it work with breast cancer too?
Yeah, strong evidence shows that being inactive increases the risk for both heart disease and breast cancer in both pre and postmenopausal women. So, no matter your age, exercise is very important. I know we talk about that a lot, but it's so
Right.
true. The goal, I'll just repeat again, I know we've talked about it, is to try to aim for 150 minutes of moderate intensity physical activity, exercise, movement, whatever you want to call it. Okay.
Mm-hmm.
However, you want to fit that in. In past podcasts, we've gone over the benefits of exercise and reducing heart disease, right?
Right.
So it helps with weight loss and keeping the weight off. You'll have a smaller waist circumference, lower blood pressure, lower cholesterol and triglycerides, and better blood glucose control. But there's also exercise benefits in reducing breast cancer. So it actually helps reduce exposure to estrogens and androgens. And
Okay.
then there's these other things called insulin related factors, adipokines, and inflammation.
Okay.
Now, there's also a much lowered risk for both heart disease and breast cancer with lifelong habit of physical activity. So
Which
it's good
seems
to do.
pretty obvious.
Yeah, good to do your whole life. So the more regularly or consistently you do it, kind of the better that is for your heart and reducing your risk for breast cancer. And
Mhm.
then certainly we also need to kind of throw in sedentary activity. So
Mm.
high amounts of sedentary activity, that could be TV watching, being on the computer, using your cell phone, sitting, driving in the car, anything where you're sitting on your bottom, are associated with both higher rates of heart disease and breast cancer. In fact, being sedentary for more than 10 hours a day is a higher risk than less than 5 hours a day. So,
Which makes sense.
yeah, the more we're up on our feet and kind of moving around and doing things, kind of the better. And
Yeah.
sedentary behavior is also associated with high breast density, which is a strong independent risk factor for breast cancer.
Oh,
So,
okay.
yes.
Well, this next risk factor kind of goes hand in hand with the exercise and physical activity, and that's whether you're overweight or have obesity or what your BMI or body mass index is.
Right. This whole area was very interesting to me, as you're going to find out in a moment. But overall, overweight and obesity are major independent risk factors for cardiovascular disease, especially when the BMI gets to be above 40. That's when it's an extremely high risk. Okay. And if listeners out there, if you don't know what your BMI is, Google BMI calculator. The NHLBI site is really easy to use. You just need your height and your weight, basically, and it'll
Yeah.
calculate that for you. Okay.
And we'll put that in our show notes as well, so you have it. You can see it there too.
Okay. Now, obesity, which is a BMI greater than 30, is also associated with an increased risk for breast cancer. But what was interesting here to me is that it was specifically in postmenopausal women, not in premenopausal women. I would have thought it
Interesting.
was both. Yes.
Yeah.
Yeah, but if we look at meta analysis research, where again, they're taking lots of different studies and they kind of analyze them together, for every 11-pound weight gain, there's an 11% increased risk for postmenopausal breast cancers in women that aren't using hormone replacement therapy.
Okay.
Now, this increased risk for breast cancer for overweight and obesity is not consistently seen in premenopausal women again. Some studies show a reduced risk for breast cancer with overweight and obesity. However, there are conflicting results in there too.
Okay, so I'm guessing the reasons for this are, as people start exploring the science, you kind of sometimes end up with competing ideas as to what's causing it, right?
Right. So, one theory is that premenopausal women with obesity have a higher prevalence of having irregular menstrual cycles, or they may be anovulatory, where they're not releasing an egg. And because of these two things, they have lower exposure to ovarian sex steroids. So, if you're not releasing an egg regularly, this
Mm-hmm.
results in decreased things like estradiol and progesterone levels. And this actually does help reduce risk for breast cancer.
Okay.
Yeah, and then another possible theory is that the fat tissue that's in the breasts may actually be kind of protective. So, certainly more research needs to be done. And I don't want anyone out there to think, oh, it's okay to be overweight or obese then if I'm in my
Right.
20s and 30s and 40s. I would say because overweight and obesity increases risk for cardiovascular disease and getting other, health conditions like high blood pressure and type 2 diabetes, it's still recommended to aim for as healthy of a weight as possible.
Mm-hmm.
And the last point I want to make here with this is that as women pass through menopause, the protective effect of obesity on breast cancer risk is replaced by an increased risk. And researchers don't know when that increased risk happens. Okay, so does it happen right after you go through menopause? Does it take several years before your increased risk goes up? Some research suggests it may take a decade before obesity increases risk, but again, we still don't fully know. So here's where I
Mm-hmm.
would err on the side of caution, where
Yeah.
it's still always better, to not, carry around too much extra weight, because the risk for getting heart disease is so much greater,
Right.
right?
Yeah, and as we're gonna be doing a podcast on menopause in a couple of weeks, and we know that losing weight once you've gone through menopause is much more difficult for women. And so it seems like the best thing to do would be to try to, lose as much of that excess weight as you can before it becomes even more difficult to do as you move through menopause, right?
Right. Correct. Absolutely
So,
correct.
well, let's move on to the next risk factor. And we know this is a big one for heart disease, and that's tobacco use.
Yes. So most people know that cigarette smoking is a major risk factor for heart disease and stroke. The link between smoking and breast cancer, though, is less conclusive, with several studies showing a weak but positive association. Now, several studies have also shown an increased risk for breast cancer in women who smoked for long periods of time and for women who started smoking early in life. So if you started in your teens or your 20s and, you continue smoking, I mean, that probably makes sense that would
Hmm.
increase your risk for breast
Right.
cancer. Another possible thing here is that some of this may come down to some genetic variants too, for why some people have this increased risk of breast cancer from smoking and other women don't. And it has to do with something called acetylator variant NAT NAT2 genotype. So smokers that carry the slow acetylator variant NAT2 genotype have an increased risk for breast cancer. And then the opposite is true. If you have a fast acetylator variant NAT2, you have a lower breast cancer risk, which
Okay.
I think that has to just do with metabolism, right? So if you can break down the harmful contaminants in the cigarettes, it's not going to cause as much damage to you as if it's hanging
Sure.
around in your body longer. That's kind
Which
of what
makes
I
sense.
take from that. Yeah.
Okay. Well, let's talk about something that's a little more in your in your wheelhouse that you know a lot about, and that's diet. And how does
Mhm.
diet, we know how it impacts heart disease a lot already, but can you tell us how it works with breast cancer as well?
Yeah. So hopefully I've driven this point home a lot that healthy eating
You
patterns
have with
similar
me.
healthy eating patterns similar to the DASH eating plan or the Mediterranean diet where you're eating a lot of plant-based foods, fewer animal foods have been found to lower the risk of cardiovascular disease and dying from, cardiovascular disease by about 30%. Whereas a Western dietary pattern or the SAD diet, standard
Mm.
American diet, which is high in red meat, processed meats, refined grains, and added sugars, is associated with a 22% increased risk from dying from cardiovascular disease. Now, dietary patterns and breast cancer risk are less conclusive. And what
Okay.
they're finding is that it may depend on the type of tumor you have too, which is sort of interesting. In the Nurses' Health Study, a diet that was high in fruits and vegetables was associated with a reduced risk for estrogen receptor negative breast cancer. And then there was also that reduced risk for estrogen receptor negative breast cancer when you followed a diet that was high in plant proteins and plant fat and was kind of moderate in carbs. Okay, not low carb, but just eating sensible portions of them. And then I do want to point out there's another large study of Canadian women where there was a 31% reduced risk of breast cancer when they followed a dietary pattern that was recommended by the American Cancer Society, which is similar to the Mediterranean diet as well. So again, more plant-based foods, fewer animal-based foods. And then the same thing was found in a Women's Health Initiative study, which had 66,000 postmenopausal women in it. So the women who adhered to this American Cancer Society dietary guidelines had a 22% lower risk in breast cancer. So it does seem like, there is this reduced risk also with breast
Right.
cancer. I think it's always hard with nutrition studies. I think I've talked about that before in previous
Mhm.
podcasts that, nutrition studies are always harder because there's so many confounding variables and
Mhm.
how do you make people eat a certain way for a long period of time? It's hard to do
Right.
cause and effect. So what we're left with are observational studies and things like that, where you're
Sure.
doing questionnaires and asking questions and following them for a period of time, right?
Mhm. Yeah.
Yeah. And then there's one last study I just want to mention that has to do with diet, and that is a study that was done on 1,100 Spanish women. The women who adhered to a Western diet, again, more of the animal foods in there and not very many plant based foods, was associated with an increased breast cancer risk. But they found this was especially in premenopausal women, which I found was
Hmm.
interesting. And the
Okay.
women who followed the Mediterranean diet, they had this reduced risk for breast cancer of all subtypes, but especially for triple negative cancer, which, if you don't know, is one of the most lethal types of breast cancer. It's very aggressive, and there's a high mortality rate with it compared to all the other breast cancer types.
Okay. That is very interesting. And
Hmm.
it's a great segue because we know the part of the Mediterranean diet includes a few glasses of wine here and there.
Hmm.
So let's talk a little bit about alcohol and how alcohol impacts both heart disease and breast cancer.
Yeah, in past podcasts, we've talked about the reduced risk for heart disease with light to moderate consumption of alcohol. Now, what that means for women is 1 drink per day, okay? Drinking more than 2 drinks per day, just so everybody knows, you do not get additional cardiovascular disease benefit.
More
I
is not better.
More is not better when it comes to alcohol for either your heart, and there's no cancer-related benefit to alcohol consumption, just so you know that. In
Okay.
fact, alcohol is a well-established risk factor for breast cancer in both pre- and postmenopausal women, okay?
Okay.
And when they've done meta-analyses on alcohol and breast cancer risk, there's a 5 to 9% increased risk for breast cancer per drink per day.
Wow.
And I want you to pay attention to this next statistic. And I like triple check this because I'm like, that's got to be wrong. But consuming 2 alcoholic drinks per day for 5 years is associated with an 82% increased risk for breast cancer compared to non drinkers.
Wow. That's huge.
Yes, that is huge.
Huge.
So be careful, ladies. Booze is not good for the breasts, okay?
Yes.
Yeah.
Okay.
And be careful with binge drinking as well. So, in the Nurses' Health Study, adult binge drinkers had a 20% increased risk for breast cancer compared with non drinkers. So, I think sometimes we think, oh, well, I don't drink all week and I have a little extra on the weekend. That's
Right.
not great either if you're going overboard. So, I guess based on this, I would say just be kind of careful with that. And
Yeah.
then the other thing I found really interesting in looking at the research in this area is that the most dangerous time actually for women to be drinking alcohol is the time between they get their first period and their first pregnancy, okay?
Oh.
Which is often up to like, in the studies I saw, up to like age 30. Okay.
Okay.
I mean, your risk is, there's always a risk throughout your whole lifespan, but during that time, it's especially harmful, because remember, alcohol is considered a carcinogen. Okay.
Mhm.
And regular alcohol consumption and binge drinking is thought to change the breast tissue. So it's more likely to become cancerous. And that changes after you have a baby. Okay. So that's why they think it's kind of more harmful during that period in time for a woman.
Sure.
Yeah.
Well, and let's be real. I mean, when are you doing the bulk of your, binge drinking, partying years are, kind of like those late teen through your
Yeah.
20s.
Yeah. And
That's
that's
when you're
actually,
doing it.
I know, and it's actually the most dangerous time to maybe be doing it, is what
Yeah.
that is showing. So, yeah, so just be careful. If you have a teenage daughter, a college age daughter,
Yeah.
you might want to, talk to them about that a little bit. And then the last thing I wanted to mention on alcohols, this is kind of interesting too, is that, some of this comes down to how alcohol is metabolized in our body. And so when we drink alcohol, it's converted to something called acetaldehyde. And this can combine with things called reactive oxygen species. And this can cause DNA damage and actually prevents DNA repair because your body's always trying to
Wow.
repair itself from things. So the
Sure.
more alcohol you're kind of drinking that's got to get metabolized, the more potential there is for that to maybe cause some DNA damage and lead to cancer. And then the last thing here is that alcohol, what's interesting is that for whatever reason, it stimulates estrogen receptor positive breast cancer cells, but not estrogen receptor negative cells. And a lot of this comes down to the fact that when we drink alcohol, it actually releases higher amounts of estrogen into our bloodstream.
Okay.
Yeah,
Huh. Who knew?
I
Right?
know. So be careful with the alcohol, ladies. Again,
Yes.
booze, not
Long
great.
story short.
Booze, not great for the breasts.
Switch gears a little bit now, and we're going to talk a little bit about how cancer treatment affects the heart. And this is kind of a little preview for next week's episode. In next week's episode, Heather's going to be interviewing a cardiologist and a nurse practitioner from the Karen Yontz Center for Cardio-Oncology located at Aurora St. Luke's Medical Center in Milwaukee. So, Heather, can you walk our listeners through the cancer treatments that are known to potentially have these adverse effects on the heart?
Yeah, there's 3 main treatments to talk about. The first one is chemotherapy treatment, and this most commonly causes significant and irreversible left ventricular dysfunction and can also cause arrhythmias, so it gets your heart rhythm off, can also cause cardiomyopathy, myocarditis, pericarditis, and even heart failure. Radiation treatment is the second one. Now, especially if this was performed before 1990 or if the radiation involved the left chest, it can damage heart tissue and heart valves. Radiation treatment also increases the risk for a heart attack, cardiomyopathy, and arrhythmias, and it makes heart surgery riskier in the future. And then the third one is hormone treatments, such as tamoxifen and aromatase inhibitors. Now, these things drastically reduce estrogen, which can increase the risk for things like blood clots, pericarditis, heart attacks, and sometimes heart failure. Now,
Okay.
it's important to note that these cardiotoxic effects from cancer treatment can occur early on, or they can be delayed, sometimes even decades later.
Okay. Well, like we mentioned at the beginning of the podcast, there's more women who are surviving breast cancer, which is a good thing. But this also there's potentially many more women who are at risk for these adverse effects from the treatments that you just mentioned.
Yeah, that's correct. And there's also some breast cancer survivors who are at an even higher risk for adverse heart effects. So I just want to go through three things here. So the first one is an older age at time of cancer treatments. So that's defined as 60 years of age or older. The last two will sound kind of obvious, but having two or more cardiovascular disease risk factors during or after cancer treatment. So if you have diabetes, high cholesterol, high blood pressure, obesity, or if you smoke. And then the last
Okay.
one is a history of heart attack, valve disease, or what's called low normal left ventricular function before or during cancer treatment.
Okay. So we've talked a lot about a lot of different ideas today. And what we know now is all of these ideas have come together and has led to the development of an emerging field in both cardiology and oncology, which is called now cardio-oncology.
Mm-hmm.
And it's also led to what we have at Aurora St. Luke's Medical Center, which is the Karen Yontz Center for Cardio-Oncology. So can you share with our listeners just a little bit of the background about the Karen Yontz Center for Cardio-Oncology and what they do?
Yeah, the Karen Yontz Center for Cardio-Oncology has really come full circle with Karen Yontz and why she developed heart disease despite living a healthy lifestyle. We now know Karen had cardiotoxic side effects from her treatment for Hodgkin's lymphoma that she had in her 20s. Karen was passionate about educating women about heart disease, so after she passed, her husband Ken and their friends generously donated money to Aurora St. Luke's Medical Center to establish the Karen Yontz Women's Cardiac Awareness Center.
Yay!
Yay, where Bethany and I and Kirsten all work. Today, we continue Karen's mission to help educate women to keep their hearts healthy and to live a heart healthy lifestyle. Now, down the line, Ken Yontz donated money once again to establish the Karen Yontz Center for Cardio-Oncology to further help women like his wife, Karen, and others whose hearts have been affected from cancer treatment. The Karen Yontz Center for Cardio-Oncology has a team of doctors and nurse practitioners who work closely together to develop a patient-centered plan of care to protect women's hearts. They care for your heart during and after cancer treatment to minimize damage to the heart.
Yeah, and I think it's important to point out, like you said, Karen herself received treatment for Hodgkin's lymphoma, and the Karen Yontz Center for Cardio-Oncology treats patients with all types of cancer where these cardiotoxic treatments might be impacting them.
Mm-hmm.
And that also includes men.
Yes.
So it's not
Yes.
just women, it's not just breast cancer. They do a lot of good things for many people who are going through cancer treatment who might need the extra attention from cardiology as well.
Yes.
So, what are the heart symptoms women should be on the lookout for if they've had cancer treatment that might be concerning?
Yeah, there are 6 symptoms to pay close attention to: weakness, fatigue, dizziness, chest pain, irregular heartbeat, and then swelling in the legs and feet.
Okay. And then if someone is experiencing any of these heart problems and they want to reach out and contact the Karen Yontz Center for Cardio-Oncology, we'll put the number in our show notes as well. But how can they reach them, Heather?
Yeah, they can call the Karen Yontz Center for Cardio-Oncology at 414-646-2662. Now, at the Karen Yontz Center for Cardio-Oncology, they will conduct a thorough cardiovascular disease assessment and then determine the best plan of care to protect your heart.
Excellent. Well, we had a lot of information today in this podcast, so I hope all of you out there learned a lot about the connection between breast cancer and your heart. And it's important to remember to take care of yourself to reduce your risk for both breast cancer and heart disease, especially because, we'll say it again, heart disease is women's number one health threat. So Heather's going to continue this discussion next week with cardiologist Mamit Singh and nurse practitioner Jody Barani from the Karen Yontz Center for Cardio-Oncology. So be sure you tune into that.
All right. Thank you for listening in today, everyone. And as we always say, be the ruler of your own heart. Goodbye.
Bye-bye now.
Thank you for joining us on the Queen of Hearts podcast. Our podcast is recorded here at the Karen Yontz Women's Cardiac Awareness Center inside Aurora St. Luke's Medical Center in Milwaukee, Wisconsin. For more heart-healthy tips, info, recipes, and more, visit our website at www.karenyontcenter.org, like us on Facebook at Karen Yontz Center, and follow us on Pinterest. If you like what you hear, subscribe to our show and be sure to tell your friends. Until next time, ladies, be ruler of your own heart.